Hi, I'm Dr. Murata. We're here to do Kybella injections straight on Tracy. Tracy's works here at the office. She's a licensed esthetician and she is bothered by the submental fat. So submental means under the chin, and sometimes people just for whatever reason, it might be genetic, they store a little bit more fat underneath there than they'd like. So there's a way of non-invasively melting that fat, and the treatment's called Kybella. Kybella is manufactured bile acid. Bile acid is what our body uses to help dissolve its own fat, so it causes what we call lipolysis, destruction of the fat cells. So it's done via injection. It's done via simple injection, and then you can have some redness and some swelling in that area, and then your body slowly absorbs that fat over 6 weeks or so. Typically, several treatments are required to get the desired result, usually 3 to 4 treatments, and we space them out by 6 weeks. So Tracy, how many treatments have you had already?
I've had 2 already.
She's had 2 already, and she's on her 3rd. So this is the area that we're talking about. Return to the side here. This is the submental area, and if I pinch between my fingers, I feel a little bit of fat deposits left, so she's going to get her last treatment today. And one of the good things about Kybella is because it causes a little bit of inflammation underneath the skin, you get sometimes a general skin tightening with it as well. It's good for patients who, the younger the better, because if you have good skin elasticity, once the fat is melted, the skin will kind of snap back like an elastic rubber band. If you're older and then we melt some of the fat underneath there, the problem might be you could have some looseness of the skin. So then other treatments might be necessary to help that problem. Maybe Ulthera, which is an ultrasound treatment to tighten it up, or even surgery. So you have to kind of keep that in mind. If it's something that it's really more of a problem of loose skin and it's not really fat, that's the problem, Kybella might not be the ideal treatment for you. But in terms of your candidacy, we will always obviously discuss the thorough physical examination is done, so we know whether you'd be a good candidate for Kybella prior to the treatment. Okay, so the first thing I like to do when we do the Kybella injections is mark out the safe zones. So typically this is called a labial mandibular fold. From that area I mark a straight line down here. And safe zones are areas where the Kybella can go. When you go beyond that, there's certain issues. For example, over here, here's a nerve called the marginal mandibular nerve, which controls smiling, so we don't want to inject in that area because that's kind of a danger zone. And then this is the bone called the hyoid bone, and we want to inject kind of above that. And then here, this is just drawing the border of the mandible. And then we place a little tattoo, and this is generally where most of the fat is located. This is called the submental fat deposit right underneath here. So that's what we want to treat. In this area, there's really usually not very much neck fat anyway, and some of the other structures here really can't take Kybella to be injected, so we avoid those other zones and focus on the area where the fat is. So the next thing is just application of tattoo. A tattoo has these little evenly spaced dots and just allows us to basically evenly space the injections apart. Okay, so once that's done, we have a bunch of evenly spaced dots, which kind of dictate our points of injection. These are apart. Usually we want about 20 dots in that injection zone, so some of them I'm going to erase now. And in each spot, about 0.2 is placed. And it's important to kind of place these injections deep enough that it's underneath the skin, because you get less swelling that way. You don't want to make them too superficial, because then you're really not getting into the fat. And generally patients at this point, they're pretty comfortable, but they'll start to, are you getting any burning or stinging?
Only slightly.
A little bit. About halfway through the treatment, you start to typically get some stinging stuff. So I try to do it quickly so we can get back to the ice pack pretty fast. Okay, so the procedure is done. She'll have some stinging, a little bit of burning sensation. which will persist for a few hours, mild though not severe. Lots of ice, I tell patients in the beginning. Some patients don't get very little swelling, very little bruising, they're kind of back in action right away. In some patients, they get significant swelling. It even looks like a bullfrog. It really swells quite a bit. Either way, it's not dangerous. It resorbs in 3 to 4 days. So first Kybella injection, sometimes people want to space it out over on a Friday and do it so they have the weekend to kind of recover and get back to it. If they're not one of those patients that gets any swelling or reaction, they can do it and go right back to work, and it's not a problem. Typically, I tell people don't work out for the 24 hours. You want to always avoid aspirin, Motrin, any other blood thinning products prior to injection to minimize your potential for bruising. Numbness is normal. Some patients get some numbness that persists even up to 6 weeks or so. Generally, though, it's self-limited and goes away.
I'm good.
Okay. You're good?
Thank you, Dr. Morales.
You're welcome.